Bill. My name is Shanna, and I'm the nurse for Dr. Bruno. And I just wanted to go over a couple of things with you since you are going to be having the robotic surgery. So do you have any questions or concerns about anything, first of all?
Yes, lately my back has been hurting and I've been having a difficulty going to urinate.
Okay. So do you feel like you're full, or are you emptying your bladder all the way?
I feel like I'm not emptying it all the way because I will go to the bathroom and then 5 minutes later I'll sit on the couch and I feel like I have to go again.
Okay. So was this like what you were having prior with when you had the TURP done a couple of years ago?
Yes.
Okay. Well, we'll do a quick assessment and then we'll talk about some things afterwards. So I see that your blood pressure and your vital signs, everything looks good. Your blood pressure is fine. Are you still taking the medication?
Yes, I am.
Okay. And it's the Lamoxin, the Topol, and the... What else are you taking?
I'm also taking Coumadin.
Okay. And so are you having any problems or concerns about any of your medications?
No, I've been taking them for a while. Sometimes I forget what to eat when I take the Coumadin.
Okay. And one of our great resources that we have in the community is that you can actually see a nutritionist. So do you think that would maybe be a good idea? She can kind of help you figure out what's going on with your diet in regards to the medications that you're taking.
Will I have to pay for it?
No, it's part of the survivorship that we have here in the community with the cancer, with our cancer patients. It's something that's taken care of through our DRHA process that we have here.
Okay, I would be interested.
Okay, cool. And so we'll kind of go over that at the end of the process, kind of talk about some other resources that may be beneficial for you and your family. Okay?
Okay.
Okay. So as I said, your blood pressure and your heart rate looks good. So I'm just going to take a quick listen to your lungs and your tummy. And see how things are going. Are you having any difficulties urinating or having bowel movements?
No, that seems to be okay.
Okay. When was the last time you had a bowel movement?
Yesterday.
Okay. And it looked okay? No blood or anything in it?
No.
No? Okay. Have you noticed any blood in your urine when you go?
I've noticed like a streak.
Okay. And when is that usually? Is it with each time you go?
I notice it more in the mornings.
Okay. Okay. So if you'll lean forward, take a deep breath for me. Good. And out. Again. Good. Out. Again. Out. Again. Out. Good. Now I'm just going to take a listen to you. You can breathe normally. Okay. Good. Everything looks good. Now, how's your appetite?
Some days my lady friend comes over and she cooks some collard greens.
Oh, okay.
So most of the time I'll eat it, but sometimes I like lose my appetite. Not because of the meal, but she's not that great of a cook.
Oh, okay. So have you lost any weight over the past couple of weeks or so? Have you noticed?
I noticed I probably lost about 10 pounds.
Okay. And was that unintentional or just because you don't have an appetite?
It's unintentional.
Okay.
Yeah.
One of the things with the collard greens is that you definitely bring that up with the nutritionist because that could be interfering with the Coumadin that you're taking.
Okay.
Okay. All right. So I'm going to take a look at your legs here.
My legs have been swelling a little bit.
Uh-huh. And have you told your cardiologist about that?
I forgot to mention it at our last visit.
Okay. And do you ever put your legs up or anything to kind of help with some of the swelling?
No, I've been just trying to walk. I've been walking a lot and trying to do exercises.
Okay. And what about your walking? Are you stable? Do you use a cane or a crutch or having to hold on to furniture or anything when you're moving?
Well, sometimes when I walk outside, I'll pick up a stick.
Okay. And what's the back pain? Can you tell me a little bit more about that?
It gets a little sharp right here.
Okay.
And sometimes when I'm leaning forward, I
Okay.
can feel it. When you were asking me to lean forward to listen.
Can you stand for me? Mm-hmm.
When I go like this, that's when I have the pain.
Okay.
But when I come back, you know, I'm okay. So sometimes when I walk long distances, I feel that pain too.
Okay, but you're not using any assistive devices to walk with?
Unless I'm outside, I'll pick up a stick because I'm so afraid of having to pay for all these things.
Okay. Well, that's something also that we can look at. One of the big things is that the functionality of you being at home, because you live at home by yourself, is that correct?
That is correct.
Now, who comes and help you with any support if you need it?
My lady friend.
Okay, and how often do you see her?
Maybe 2 to 3 times a week.
Okay.
And I actually have a question about that.
Yes.
After surgery, will I be able to interact sexually with my lady friend?
Well, one of the things with the minimally invasive surgery that you're going to have, the robotic surgery, is that you're going to go home and you're going to have a catheter, which is what you had before when you had the TURP a couple of years ago. You'll go home with that, and then usually a couple of days after that, you'll come back and you'll visit with Dr. Bruno, and then he'll kind of go over some of the things. But one of the risk factors that's associated with this surgery is loss of sexual function. That means that you may not be able to get an erection and have sexual activity with your lady friend. And so that is definitely one of the things that you have to talk about. Did you discuss that with Dr. Bruno?
I didn't even know that was going to happen. I did not discuss it with him.
Okay, well that is definitely something you need to speak with him about, so you can weigh your options. At this point, you were doing pretty well with after having the surgery a couple of years ago, but now that your PSA level has gone up, which he explained that to you also, you know that you were kind of monitoring that to make sure that everything was going okay, but it's gone up quite a bit. And so he was worried enough that he did a biopsy and found out that you do have the cancer, and basically your options were just to have the surgery at this point. To wait any longer could lead to some more additional issues.
Is that why I have that change in the bladder?
It could be. It presses against in your tummy where the prostate is located. It's, you know, not in your stomach, but it can affect some of the abdominal region, and it could also compress on your spinal cord as well, which is one of the things that we need to make sure we tell Dr. Bruno about. He'll maybe get an x-ray and an MRI of your back to make sure there's not any compression or the cancer hasn't spread anywhere else. That's one of the risks that's associated with prostate cancer.
Okay. Have you seen somebody else that has, you know, these back pains, and then is that common?
It is a common side effect, but again, that's something that would have to be really looked at with Dr. Bruno, making sure that it hasn't spread anywhere else. That's, again, one of the side effects, major side effects of prostate cancer, which is one of the options you should really weigh when you're talking about if you want to have surgery, or do one of the other things such as watchful waiting and just kind of seeing how it goes, just monitoring your PSA levels, which is what you've been doing over the past couple of years with Dr. Bruno. But holistically, a holistic approach, there's a lot of other things. The nutritionist may be able to even talk to you about this, about some other things that, as far as food, that maybe can help with some of the inflammation that's going on, some things that could help you, maybe help with back pain. Also, some other resources that we have is that we do have spiritual care. Not sure how you feel about that. Is religion or any of that something that you deal with, or?
I didn't want anybody to come and preach to me and tell me how to live my life.
Definitely. And it's not about that. It's basically a chaplain who says, want to talk to you maybe, and you can pray or not pray, or just kind of get, some additional assistance just to kind of ease your mind. It's not about religion per se, but just spiritual guidance. And that's one of the options or community resources that we have as well. Also, I wanted to ask you, how did you get to the appointment today? I know you're not able to drive, right?
No, my lady friend drove me today, but some days I take the bus. Okay. And it takes me a while to get to the bus. So my appointment with Dr. Bruno is at 10 o'clock, but I have to get up like at 8 to walk an hour to the bus. And it's just because my back's been hurting, so it takes me longer to get to the bus, where before it would take me 10 minutes.
Another resource that we have is that we do have transportation vouchers. That's in the community that can help you get back and forth to your appointments. So we'll definitely set you up with that as well. Now, what about following up with your primary care physician? Or have you just been following up with Dr. Bruno and not seeing your primary care physician?
Dr. Bruno does it all. Why do I have to see another doctor?
Again, it goes back to your high blood pressure. Dr. Bruno is more focused on the urology part of your prostate cancer and taking care of that. Your cardiologist and your primary care physician are very important members of the team also, because they're monitoring your medications. If you're retaining weight, that's something that could be important. And in the healing process as you go along after your surgery for prostate cancer.
So I should have one more doctor besides Dr. Bruno and my cardiologist?
It's something that we can set up that make it easier, maybe even having all of your appointments on the same day. That's why I'm here as a care coordinator, to make sure that everything flows along as well as we can for you, so you can have a great outcome and not have to worry about things such as transportation and how you're going to get back and forth and seeing another physician, just making it smooth and easy for you.
Is my healthcare insurance going to cover all these doctors?
Yes, it is covered. One of the things that we do here at DRHA is to make sure that people who have cancer is very well provided for. It's grants and funding that's taken care of, and your insurance company takes care of the rest.
Wow, these are things I never thought about and didn't know about.
Great. So that's the whole point of me being here, is to make sure that you can navigate through the healthcare system with as little difficulty as possible. You have other things to be concerned about, such as recovering from your prostate cancer.
Okay.
Now, can I help you with anything else, or do you have any other questions?
Can I have your personal number to call you when I have questions?
I will give you my business card, and we're here for business hours. But we do have a 24-hour line that has someone that mans it, a nurse that's 24 hours. So if you do have questions in the middle of the night, she can help you. And maybe even get you an appointment to come in and see Dr. Bruno if you have additional questions.
Now, do you help with my cell phone bill too?
That's something that we can help you with. We do have social services or social workers who work in our team as well, who can help you with that.
Okay.
Okay.
All right. Thank you.
Thank you, Bill. It's been a pleasure.
Likewise.